This one running?
Hold on. I have a couple extra if you need it.
This is a really important one. This is a really important one.
You guys hear that? Oh, and
My audience today is New York State legislators. Hello, my name is Judy Moisoff. I want to talk about Willowbrook and New York State's current home care situation. As a Willowbrook survivor, this topic is of great importance to me and I am grateful for the opportunity to testify. We must provide better wages to our healthcare aides to make sure we will never return to the inadequate housing and outright abuse that happened at Willowbrook due to improper funding. To help you understand why this is so important to me, I want to share with you the history of Willowbrook. This is also my history for 9 years, from age 12 to age 21. The residential school's reputation was that of a warehouse for New York City's disabled children. By 1965, Willowbrook housed over 6,000 disabled children, despite having a maximum capacity of 4,000. Senator Robert Kennedy toured the institution in 1965 and proclaimed that individuals in the overcrowded facility were living in filth and dirt, their clothing in rags, in rooms less comfortable and cheerful than the cages in which we put animals in a zoo. Donna J. Stone, an advocate for mentally disabled children as well as victims of child abuse, gained access to the school by posing as a recent social work graduate. She shared the crowded, filthy living conditions at Willowbrook and the negligent treatment of some of its residents with members of the press. Shortly thereafter, in early 1972, Geraldo Rivera, then investigative reporter for WABC-TV in New York, conducted a series of investigations at Willowbrook uncovering a host of deplorable conditions, including overcrowding, inadequate sanitary facilities, and physical and sexual abuse of residents by members of the school staff. A class action lawsuit was filed against the state of New York in federal court on March 17, 1972. The publicity generated by the case was a major contributing factor to the passage of a federal law, the Civil Rights of Institutionalized Persons Act of 1980. The day I left Willowbrook was the day I was set free. But I did not realize how hard it was going to be to find a place to live and an aid on my own. Today, the majority of the city's home health care aides are earning poverty or near poverty wages, according to a new report from the Healthcare Advocacy Coalition Alliance for a Greater New York, commonly known as ALIGN. The report finds 62% of those surveyed earn less than $25,000 a year. All survey respondents across various caregiver and care recipient subgroups shows raising wages of home care workers as the objective they would most like to see the New York Care Council pursue. People who receive home care who responded to the survey and participated in focus groups were well aware of the low wages home care workers earn, and there was broad support among people who receive care for increasing worker pay. I feel my aid is worth more. When I need help, it is hard for me to ask when I know she makes no money. I like my aide. We spend so much time together. I care about her and I want her to be happy. Nearly 1 million New Yorkers will need a home health aide in the next few decades. These findings reveal that New Yorkers have a great deal at stake in the home care system, their financial security, health and safety, and dignity and respect. So, now is really the time to transform the system into one that works for both caregivers and people who receive care. Building a home care system that works for caregivers and people who receive care will require innovative policy and organizing approaches, as well as a cultural project to address the classism, racism, nativism, sexism, heterosexism, ageism, and ableism at the root of the undervaluation and indignities that both caregivers and people who receive care experience within the home care system.